We have heard from a variety of sources that violence in healthcare workplaces is, quote, part of the job. In fact, what is part of the job is the risk of violence, making it an occupational hazard that must be managed. It is the role of persons at all levels of the workplace to contribute in this regard. This unit discusses the roles of individual students and therapists in managing violence. Of course, the best management strategy is prevention. Knowing the antecedents to violence, whatever its sources, is the best approach to preventing it. Mitigating and managing violence begins with each and every occupational therapist evaluating their individual patients and the environment in which they are being treated for the potential for violence. A number of studies examined the occurrence of violence from the perspective of personal or individual characteristics. One of their findings was that the younger the healthcare professional and or the less experienced they were in their current workplaces, the more likely they were to be victims of violence. Han et al. Suggested that younger persons may not have acquired the skills to predict and diffuse violent situations. This can be fairly easily rectified by ensuring students and new employees are provided education and training in this area. On the other hand, Shields and Wilkins hypothesized that younger nurses may more readily acknowledge and report incidents of violence because they are less likely to accept it as being part of the job, or because they may have been exposed to different societal norms. If this were the case, it would be a good step in the right direction. Communication skills are included in this list of antecedents because studies have shown that the level of information patients and visitors receive from healthcare professionals is an important factor in predicting violence. This is important information for education programs as well as for individual students in targeting the skills they need to mitigate violence. In the context of psychological violence, studies have demonstrated that conscientiousness, as measured using the five-factor model of personality theory, may be predictive of healthcare professionals feeling bullied, regardless of job and environmental characteristics. This is supported by related research that established that high job performers, i.e., conscientious people, are more likely to be targets of bullying because of fellow group members' envy. Finally, studies have demonstrated that psychological violence in the form of bullying challenges one's sense of professional competence as well as one's feelings of self worth. A weaker professional identity may hamper one's ability to push back against this type of aggression. The essential competencies of practice for occupational therapists in Canada lists the many skills and competencies inherent in the practice of OT that are part and parcel of the assessment and management of patients. The competencies provide an important guideline for addressing the factors listed in the previous slide. It is the responsibility of each of us to regularly revisit these competencies and to ensure that we are able to demonstrate them and to include them in our continuing professional development activities. The competencies that are especially relevant are listed here and on the next three slides. In light of the evidence collected for this module, one can understand how these will contribute to the mitigation and management of violence. The competencies relate to a thorough and holistic assessment process, clear and comprehensive communication with patients, their family members, and team members, and a constant scoping of the care environment. I will give you a few seconds to go over them. The reference for finding them online is provided in the last slide of this unit. Again, a few moments for you to read through this slide. Some of the competencies relate not to patient treatment specifically, but rather to the therapist's skills in evaluating and management their own practice routines and environments. The goal is to ensure vigilance and to address risks as soon as they are identified. Please take a few seconds to review these competencies. Of course, occupational therapists in non-clinical positions are not exempt from the competencies related to assessing, mitigating, and/or managing risk of violence. These individuals may in fact have even more responsibility in this area than frontline therapists. For example, in recognizing safety problems and responding to correct them and to prevent them where possible. In the case of horizontal or vertical violence, there of course may be situations when even expert application of professional and personal competencies are not sufficient. In such cases, seeking assistance from your professional associations or from your union is a potential way forward in dealing with abuse. In the event that reaching out in this way is not successful in resolving the issue, changing jobs or departments may be required. A study by Lee and Botheridge on harassment and bullying in the workplace demonstrated that active forms of dealing with bullying, that is, speaking to the perpetrator or reporting him or her, can have the undesirable effect of escalating conflict and increasing victimization. In such situations, the only viable option may be to leave the organization. Of course, possessing the clinical and communication skills to manage risks of, and indeed actual violence, is the number one strategy to assume. Taking responsibility for this through continuing professional development is key. It is, however, only a beginning. Studies have demonstrated that consistent and enduring lack of recognition of one's scope of practice and professional values results in psychological stress and renders one more vulnerable to harassment and bullying. Canadian occupational therapists in a study by Durkatz spoke of the need to, quote, be valued as clinicians and to use this sense of value and worth to drive change in relation to workplace violence. Seeking profession specific mentoring and support for, among other reasons, the nurturing of one's professional identity can be a balm in these situations. Healthy interdisciplinary collaboration has also been shown to mitigate the risk of violence. Assuming the role of change agent in this important area by contributing to the development of organizational strategies to prevent, identify, and respond to violence is also recommended. Unfortunately, fewer than 15% of people being bullied go to their managers or ask for help, and 80% of persons who are bullied will find a new job. Reporting violence is critical. If it is not reported, it cannot be addressed. As a result, statistics and trends regarding the occurrence of violence are either not present or inaccurate, and solutions are not triggered. The next unit discusses the role of organizational instances in managing workplace violence.